Okay, now we are going to wrap up now that you've listened to all 10 vignettes that are focused on different aspects of the WSC model in relation to child health, both in general and, child mental health, both in general and in response to the pandemic. So where are we going with this broader project? So this is actually an initiative that our State School Health Council started about 7 or 8 months ago. I think it started prior at the end of 2020, where we decided that we really wanted to focus on a product this school year, something that tangible that we could provide to our partners, both in Maryland and throughout the country, that might be useful as we all recover from the pandemic. And so we actually wrote an academic paper. And so the paper is currently under review. And so once that is available, we will certainly promote it and share it with our partners. But then from that paper, we decided to take this, this academic product and transition it into this presentation in a way that would be potentially digestible by lots of different audiences. So what we've decided to do is take this entire hour-long presentation and load it to our State School Health Council website. In addition, we are going to keep those individually recorded 3 to 5 minute vignettes that we pulled together with all 10 components and have those posted individually. So if there was one specific idea that you heard today or one specific speaker that you wanted others to hear from, you could share the link with them, but specifically tell them, be sure to listen to family engagement. That's the one that I think we really need to listen to. Listen to the nutrition environment topic, whatever it is that you think that would be really, really particularly of interest to your school or your LEA. You can just listen to that one. So you don't have to listen to the whole hour all over again or have your colleague listen to the entire hour. So that is our plan. It is not available as I'm recording this, obviously, but hopefully we will get those loaded quickly. If you need access and they are not available yet on our website, please reach out by email and we will certainly follow up with you. In addition, we are working with some partners at the Johns Hopkins Consortium for School-Based Health Solutions to develop handouts that will be easy to read, one-pagers, kind of outlining those different areas that we talked about today. They'll be bright and colorful and again, easily translatable to the school level. So all of the content that you heard today in the presentation form will be available in these easy to read one-pagers, also loaded to our website, and I assume the consortium as well. So they've been wonderful partners in this larger project. So more to come on that, and hopefully all of these products will be available by the end of the summer at the latest, so that they're prepared by the start of the school year. And so I just wanted to wrap up by letting you know a little bit about the State School Health Council in case you are not a current member. We would love for you to join. I'll start by just letting you know our mission. So our mission is to promote health for the whole child. So again, very relevant to the WSC model. Through health promoting programs and policies and providing leadership and support to local school health councils and state and local agencies. And this is a legislated entity. This is something that is required to be in place in Maryland. And the legislation part specifies that it must be a partnership between the State Department of Education, the State Department of Health, and our local education agencies. However, over the years, we have certainly expanded to include our partners in nonprofit private schools, residential childcare institutions, in schools directly, so not just working with the school system, but also working with schools in Maryland. And then we've brought in a lot of different partner agencies, and those agencies have really been really very helpful and in moving our mission forward. And I say that as someone who is a member of a partner agency, since I'm at the University of Maryland School of Medicine and not specifically affiliated with one of these other groups. But that partnership that we've created has really been very helpful, and again, moving our mission forward. So I'll just tell you briefly that we know it's been around a long time. We tried to look back to find out a little bit about what the origin story for the Maryland State School Health Council, and all we know is that it was formally reorganized in 1966, which means it was clearly around before that. The purpose that was specified in this document that we found in a basement in a building in Annapolis was that it was to assist in the development and maintenance of school health programs and promote effective and comprehensive school health programs. The first time I shared this information a few years ago, we joked that this document talked a lot about infectious disease like tuberculosis and other health issues that schools were facing. Clearly, obesity and other chronic health concerns were not as highly addressed in this document. And at the time, infectious disease was not as big of a concern among school health practitioners as it clearly is during a global pandemic. So things have changed a lot in the past few years as we now think more about infectious disease again. This document did say that the council studies, plans, and recommends action aimed at identifying health needs and remediation health programs for school-age children. And it's basically a forum for the departments of education and health, local partners, and other groups. Just like I was saying, all those partners who are at the table, the State School Health Council is meant to be an entity that brings all of those groups together. We are structured so that we have an executive committee that is composed of a chair, and I am the current chair of the State School Health Council. We have 2 vice chairs. Those vice chairs are meant to, between the chair and then the 2 vice chairs, the 3 individuals who are leading that executive committee are, it's specified in our bylaws that they represent, one represents the State Department of Ed, one represents the State Department of Health, and then one represents another agency. And so again, I'm with the University of Maryland School of Medicine, and that is my other agency that I represent. And so that we want to have a balance of power in those 3 positions so that the different agencies are represented. And then we also have a secretary and treasurer. Current secretary and treasurer is Christy Corona, who is absolutely fantastic and has really been instrumental in helping to move so much of our work forward. And she works with me at the University of Maryland School of Medicine. We have an executive board of invited members. Currently, we have 32 members. We are always looking to expand to include other school health council representatives from our LEAs. So if this is something you might be interested in, please let us know, and we can discuss the role of the executive board more in depth. Essentially, we meet every other month and really choose different goals for each school year to move things forward. And then finally, our general body is currently composed of 220 members. Essentially, it's just getting on a listserv. So if you are not a part of our State School Health Council general body and you would like to become a member, I'll tell you how to do that in the next slide or 2, but all are welcome to join. You will get emails about the SHIP conference, emails about webinars, and different types of emails. Again, I'll tell you more about in a minute, and you can always opt out of those emails. So generally, again, what we do with those emails that the general body gets, we focused on 3 topic areas, and these topics came from listening sessions that we held in 2018, and these are areas that we're still working on today. So we currently partner with the University of Maryland Carey School of Law very closely. Past couple of years, they've been fantastic partners for our State School Health Council. And as part of what they already were doing prior to partnering with us, they provide weekly legislative updates on school health issues. So I know that there are lots of different agencies that provide school bills specifically, but these are really about school health. So if you're interested in digging a little bit deeper into those concerns around youth health in general, they talk about other tobacco legislation and healthy eating and physical activity legislation in addition to schools, but one of the tabs on their Excel sheet has to do with schools, and I just find that really, really helpful. And then they're also willing to provide support for our local school health councils. So if you are invited to to testify or to comment on a bill and you're nervous or don't know where to begin, our partners in the Carey School of Law are happily there for you. It's part of their mission and what they hope to do. We provide opportunities for networking. We have done in-person meetings at SHIP that were fantastic, or we actually only had one in 2019. And then of course, we met virtually last year and again this year, hoping to be in person again one day with all of our group together. And we give out an annual award for school wellness promotion that will be given out this year at our first webinar in the fall. And that brings me to communication. We do host bi-monthly webinars on lots of different topics. All of our webinars are recorded and they are shared on our website if you want to find out more about those topics. And then starting this year, we really have been focused on generating products that would be helpful for our state, or for our local school health council members, and also really broadening the visibility of the great work that's happening in Maryland. So those academic papers can help with that, but also from those initial kind of, topics that we bring together through an academic product, we can then create guides or reports or one-pagers and those types of things that may be helpful. And so finally, how to join our State School Health Council. You can visit our website, which is listed here. We also have a Gmail account that you can email directly to get on our distribution list. Again, we would love for everyone to be a part of the general body. If you are really interested in learning more about the executive board and participating in that, we are happy to have a discussion with you and find out more about your interests. But we are looking for greater representation of our different LEAs and partners at the system level, but others are welcome as well. So we definitely love to have that conversation. So we hope that you took away some great information around what you can do to support mental health among the students in your schools, starting in this fall, especially in response to the pandemic. We hope you learned something new today. And we hope that you will be able to visit our website and share some of the information that you learned today with others in your LEA or school. And if you have any questions, please reach out to us. We are available for any further discussion you would like to have. So thank you again for listening and have a wonderful day.